Okay, let's unpack this. Imagine something microscopic, right? A tiny organism, quietly wreaking havoc inside an animal, leading to some pretty devastating health problems.
Hmm.
Now imagine those problems aren't just contained to that animal, but actually have surprising direct implications for us.
Yeah, that's the key connection.
Today, we're taking a deep dive into a condition that's uh, far more complex and revealing than its name might suggest. Porcine valvular endocarditis.
What's truly fascinating here, I think, is that this isn't just a heart condition in pigs. It acts like a critical report card for an entire agricultural system.
A report card, I like that.
Yeah, and its ripple effects extend far beyond the farm gate. We've gone through a stack of highly detailed sources, from cutting-edge veterinary research papers to clinical reviews, really trying to extract the most critical insights for you.
Right.
Our goal is to kind of peel back the layers and understand not just what porcine valvular endocarditis is, but its underlying causes, how it progresses, and maybe most importantly, its often overlooked public health connection. Ultimately, we'll see how it serves as this powerful indicator of overall herd health and, frankly, management.
So to begin, let's just ground ourselves in the basics. When we talk about porcine valvular endocarditis in pigs, or PVE, what exactly are we describing?
Simply put, it's an inflammation of the heart's inner lining, specifically affecting the heart valves.
Okay.
It's predominantly caused by bacterial infections, and when it takes hold, well, it can tragically lead to heart failure and the spread of infection throughout the body, what we call systemic embolism.
Wow.
It's a significant concern, particularly in intensive farming environments where factors like stress and crowding can sort of create the perfect storm for infection.
Right, those stressors.
Exactly. But here's the crucial insight, I think. PVE isn't typically a primary heart disease that just pops up out of nowhere.
Oh, okay.
Think of it more as a systemic endpoint pathology, which sounds technical, I know.
Break that down a bit.
It just means it's the final, often fetal manifestation of problems that actually originated elsewhere in the pig's body.
I see, so it's a symptom of something bigger.
Precisely. It usually points to a breakdown in biosecurity or management practices. So if you diagnose endocarditis on a farm, it's a big red flag. It signals deeper systemic disease and probably deficiencies in how the farm is being managed.
That's a powerful way to frame it, that report card for the whole system. But why should we, people listening, care about a pig's heart condition? What are the broader implications beyond the farm?
Well, there are several layers. First, the economic impact is substantial. We're talking significant financial losses from pigs dying suddenly, poor growth rates in those that survive longer,
Right.
and then carcass condemnation at slaughter because of visible lesions or signs of widespread infection.
Okay, so the economic piece is clear.
Mm-hmm. And then from an animal welfare standpoint, it's a truly severe and debilitating condition. Pigs suffering from the chronic forms can experience painful long-term arthritis and progressive cardiac insufficiency. Basically, their heart just can't keep up. It leads to considerable suffering.
That sounds awful. And this is where it gets surprisingly relevant to you listening, right? You might be thinking, okay, a pig heart condition, interesting. But how does this connect to me?
Right.
The research here paints a very clear and maybe somewhat alarming picture.
Precisely. Because the two main bacteria responsible for porcine valvular endocarditis, Erysipelothrix, Rhusiopathiae, and Streptococcus suis, are both recognized zoonotic pathogens.
Zoonotic meaning?
Meaning they have the ability to transmit from animals to humans.
Okay, that's the connection.
Yeah. To put it clearly, Erysipelothrix Rhusiopathiae. In humans, it typically causes a localized, painful skin infection. It's known as erysipeloid. You might hear vets refer to it as seal finger sometimes.
Seal finger.
Yeah, because marine mammal handlers can also get it. It just shows how robust these bacteria can be across species.
Interesting. And the other one? Streptococcus suis.
This one poses a more severe threat, generally. In humans, it's capable of causing really life-threatening infections, including meningitis, that's inflammation of the brain, and spinal cord lining,
Wow.
septicemia or blood poisoning, endocarditis in humans too, and even permanent hearing loss.
Permanent hearing loss from a pig bacteria. That's definitely an alarming connection. So who are the individuals most at risk of contracting these infections from pigs?
Well, it's primarily those who have direct contact with pigs or their tissues, so farm workers, veterinarians, abattoir personnel. Usually transmission occurs through skin contact with infected pigs or maybe contaminated materials.
Okay, that makes sense. So with those serious implications in mind, let's dig into the main bacterial culprits behind PVE. You mentioned two key players.
Yes, The vast majority of cases are indeed attributed to those two key gram-positive bacteria we mentioned, Erysipelothrix, Rhusiopathiae, and Streptococcus suis.
Gram-positive, that just refers to how they stain in the lab, right? Helps identify them.
Exactly. It's a classification based on their cell wall structure. Helps with identification and treatment choices. One comprehensive study in Denmark, for instance, found Streptococcus in about 53% of PVE lesions and Erysipelothrix Rhusiopathiae in 30%.
So they really dominate.
They do. Let's break them down a bit. First, Erysipelothrix Rhusiopathiae. This bacterium causes a condition in pigs called swine erysipelas, sometimes known as diamond skin disease.
Diamond skin. Why is that?
Because of the characteristic diamond-shaped skin lesions it can cause. What's crucial to understand about this one is that it's incredibly hardy.
Hardy how?
It can survive for weeks in soil, even months in contaminated tissues. This resilience makes environmental contamination a really significant factor in its spread.
So it sticks around.
It really does. It's typically transmitted when pigs ingest the bacteria or through breaks in their skin. And importantly, pigs that are asymptomatic carriers showing no signs of disease are a primary reservoir.
They carry it without being sick themselves.
Exactly. So when we find this bacterium in endocarditis cases, it very directly points to issues with the farm's erysipelas vaccination program or maybe general environmental sanitation.
Okay, so that's Erysipelothrix. What about Streptococcus suis?
Right, Strep suis. This organism is commonly found as a commensal.
Meaning it just lives there normally.
Yeah, harmlessly, usually. In the upper respiratory tract, the gut, even the genital tracts of most pigs. But here's the critical insight. Up to 100% of pigs in some herds can be asymptomatic carriers.
100%. Wow.
Yeah. It means the pathogen is practically everywhere, making its control an enormous challenge even before you think about vaccines.
So how does it spread if it's already there?
Well, transmission is highly efficient, both vertically from the sow to her piglets during birth, and horizontally through things like nose-to-nose contact, aerosols, contaminated surfaces. Among the many types, or serotypes, of Strep suis, serotype 2 is globally recognized as particularly virulent, meaning especially nasty, in both pigs and humans.
Like a specific aggressive strain.
Exactly. So its presence in endocarditis cases often points towards stressors, especially in the nursery phase after weaning, maybe soda-piglet transmission issues, or potential co-infections like PRRS virus.
Right.
Because its ability to cause disease, its pathogenicity, is often triggered by factors like that. It needs an opportunity.
So while those two are the main characters in this bacterial drama, are there other, less common, bacteria that can also play a role? Opportunists, maybe.
Absolutely. While Erysipelas and Strep suis are dominant, a variety of other bacteria can act as opportunistic invaders. These include things like Truparella pyogenes, Staphylococcus aureus, E. coli, Pasteurella multicida.
A whole cast of characters.
Pretty much. And the specific bacteria found can really tell a story about the herd's overall health status. For instance, finding Truparella pyogenes often signals a pretty severe breakdown in fundamental management, like maybe uncontrolled tail biting leading to wounds or just poor wound hygiene.
Another clue on that report card.
Exactly. It all fits together. Now, for endocarditis to even happen, the absolute prerequisite is bacteremia.
Bacteria in the bloodstream.
Right. Bacteria circulating in the blood. This tells us that the initial entry point for these bacteria into the pig's body is incredibly crucial.
Where do they usually get in?
Well, these entry points are often linked to routine management practices, unfortunately, or other diseases happening at the same time. We're talking about skin wounds, maybe from tail biting or fighting between pigs, even ear notching. Unhygienic procedural wounds from things like tail docking, teeth clipping, or castration, if not done cleanly, are also common culprits.
Right.
And, of course, established infections elsewhere in the body. Things like septic arthritis, joint infections, or naval infections in newborn piglets, or even systemic spread from respiratory or gut infections can all lead to bacteria spilling into the bloodstream.
Okay, so once these bacteria are circulating in the bloodstream, that's hurdle number one. But how do they actually manage to stick onto something as dynamic as a constantly beating heart valve? Is it just random luck or...
It's definitely more complex than luck, and there are actually two main models or theories for how this colonization happens. The classic injury thrombus infection theory, which is largely based on what we know from human medicine, suggests that some pre-existing damage to the valve, maybe from turbulent blood flow, first creates a little sterile clot, like a tiny scab.
Right.
Then circulating bacteria find that spot and adhere to that preformed clot, And from there, they can multiply and establish the infection.
Okay, that makes sense.
Yeah.
But you mentioned pigs might be different.
Right. And here's where the research reveals a truly unique pathway, it seems, specifically for pigs, which is quite different from humans.
Really? What's different?
Well, unlike the traditional view of human heart valves, porcine mitral valves, that's the valve between the left atrium and ventricle, they actually have their own intrinsic microvasculature.
Tiny blood vessels inside the valve itself.
Exactly. Tiny capillaries that extend deep into the valve's core substance. And what's remarkable is that studies have found infectious bacteria, particularly Streptococcus, located deep within this valve tissue,
Wow.
underneath what appears to be an intact, undamaged surface.
So they're not sticking to the outside first.
It suggests a different sequence. It suggests bacteria might be able to directly invade the valve tissue via its own blood supply during that bacteremia event, causing an internal infection that then grows and maybe eventually erupts onto the valvular surface.
That's quite a different picture. What's the implication of that?
The implication is profound, really. It means pigs might be highly susceptible to endocarditis even without any prior valve damage.
So the valve doesn't need to be roughed up first.
Potentially not, which means that bacteremia itself, just having bacteria in the blood, becomes the single most critical risk factor. This reinforces the idea we talked about earlier. Endocarditis in pigs is largely a management-driven disease. The goal has to be preventing the bacteria from ever getting into the bloodstream in the first place.
Got it. So regardless of how the bacteria initially latch on, what happens next? You mentioned these vegetations.
Right. Once they establish themselves, they form these vegetations. They're often described as cauliflower-like, which is a pretty good visual.
Yep.
They're friable, meaning easily breakable. Masses made up of fibrin, which is a clotting protein, platelets, and just clumps of bacterial colonies. This whole structure acts like a protective shield, almost like a biofilm.
Shielding them from what?
From the pig's immune cells and even from antibiotics that might be circulating. It makes them very hard to clear out.
And these vegetations grow?
Yes, they grow, and as they do, they physically destroy the heart valve leaflets. This leads to valvular insufficiency, basically, a leaky valve.
So the heart can't pump properly?
Exactly. It severely impairs the heart's ability to pump blood efficiently, resulting in congestive heart failure and, often death.
And you said these cauliflower-like things can break apart. That sounds dangerous.
Extremely dangerous. They aren't just sitting there passively, they're friable, so pieces can break off. These infected fragments are called septic emboli.
Septic meaning infected, emboli meaning they travel.
Precisely. They travel through the bloodstream, and wherever they lodge, they cause new infections and tissue death or infarcts.
Where do they usually end up?
Well, it depends on which side of the heart the initial lesions, the vegetations, are on. If the lesions are left-sided on the mitral or aortic valves,
Okay.
the emboli enter the systemic arterial circulation. They most commonly lodge in vital organs like the kidneys, the spleen, sometimes the brain. They cause infarcts, those areas of tissue death, and abscesses. Finding pale, wedge-shaped infarcts in the kidneys at postmortem is a very frequent clue pointing towards endocarditis.
And if the lesions are on the right side, tricuspid or pulmonic valves?
Then the emboli travel directly to the lungs. This can lead to pulmonary abscesses, blood clots in the lungs, thromboembolism, and pneumonia.
So problems everywhere. What does this actually look like in a living pig? What are the clinical signs farmers or vets might see?
Well, that's one of the challenges. Porcine valvular endocarditis often presents in a highly variable way, and the signs are frequently nonspecific. They can easily mimic the primary systemic diseases that cause the initial bacteremia in the first place, like erysipelos or streptococcus.
Right, because it's part of that bigger picture.
Exactly. It's not really a standalone disease you just get. It's often part of a larger disease continuum.
So what might you see in, say, an acute case?
In its acute and subacute forms, it can sometimes manifest as just sudden, unexpected death in pigs that otherwise seemed perfectly healthy. This is especially true with highly virulent bacterial strains.
Just found dead?
Unfortunately, yes. If signs are present before death, they're usually general indicators of a serious systemic infection. A high fever, loss of appetite, profound lethargy, they don't want to move, maybe lameness, a stiff gait, pretty general stuff.
Are there any specific clues that might point towards one of the main bacterial culprits over the other in a live pig?
Sometimes, yes. With Erysipelothrix, you might observe those classic diamond-shaped raised skin lesions we talked about, often accompanied by a diffuse reddening of the ears and abdomen.
Okay, the diamond skin is a big clue for that one.
It really is. For Streptococcus suis, the bacteremia might be accompanied by signs of meningitis because it often goes to the brain. So you might see neurological signs like paddling movements, involuntary eye movements, arching of the back, even convulsions.
Right, the neurological signs point towards strep suis. What about chronic cases, pigs that survive the initial phase?
Chronic endocarditis develops in pigs that either survive an acute episode or maybe they had a persistent low-grade infection simmering away. Here, the clinical picture is more one of progressive decline.
Wasting away, sort of.
Yeah, you'll observe poor growth, a general failure to thrive, gradual weight loss. Chronic, often severe lameness due to a proliferative degenerative arthritis is a classic feature, particularly in cases linked back to chronic erysipelas.
The joints get involved, too.
Very often. And as the heart failure progresses because the valves are damaged, pigs may show exercise intolerance, they get out of breath easily, difficulty breathing, and maybe cyanosis.
That bluish tinge.
Right, a bluish discoloration of the snout and ears because they're not getting enough oxygen. And sometimes a key sign is hearing a new or changed heart murmur when listening to the heart with a stethoscope. That indicates the turbulent blood flow through the damaged valves.
Okay. It sounds incredibly challenging, though, to definitively diagnose this in a live pig on a busy farm with all these variable and sometimes vague signs.
It truly is challenging, and honestly, often the diagnosis in a live animal is presumptive. It largely relies on trying to identify that triad of signs, persistent fever, lameness, often from that concurrent arthritis, and detecting a heart murmur.
That triad.
Right. And if you see those diamond skin lesions, well, that strongly suggests erysipelas is the underlying cause. Blood cultures can sometimes isolate the bacteria, but results can be tricky to get consistently. The bacteria might not be in the blood all the time.
Right.
And while echocardiography, cardiac ultrasound is the gold standard for actually seeing the vegetations in humans, it's largely impractical for typical production pigs. It's just too expensive, the equipment, the logistics. It's usually reserved for very high-value brooding animals, or perhaps pet pigs.
So for most farm situations, it's really at the postmortem examination, the necropsy, where the definitive answers emerge. Is that right?
Absolutely. Necropsy is where we find the characteristic lesions, both within the heart and often evidence of spread throughout the body. The hallmark lesion is that vegetative valvular endocarditis.
The cauliflower.
Exactly. Appearing as single or multiple, raised, crumbly, granular, yellow to gray masses on the valve leaflets. They really do look like little cauliflowers.
Which valves are most commonly affected?
Lesions are most common on the left, atrioventricular valve, the mitral valve that's affected in up to maybe 59% of cases, followed by the tricuspid valve on the right side. The heart itself might be enlarged, what we call cardiomegaly, and sometimes we find excess fluid in the sac around the heart, hydropericardium. And systemically, we often find those pale, wedge-shaped infarcts in the kidneys and an enlarged, congested spleen, clear signs that septic emboli were traveling.
And under the microscope, does that tell you more?
Oh, definitely. Histopathology, looking at the tissue microscopically, confirms the diagnosis and provides critical clues. We see those bacterial colonies embedded within a mix of fibrin, dead tissue debris, and inflammatory cells.
Does it help distinguish between the bacteria?
It can. What's particularly revealing is that Streptococcus suis lesions are significantly more likely to show signs of mineralization, like hardening or calcification, and a type of chronic inflammation called granulomatous inflammation. This suggests a more chronic disease process, the body trying to wall it off over time. In contrast, Erysipelothrix Rhusiopathiae lesions are often characterized by a massive, acute neutrophilic infiltration, a rapid, intense flood of a specific type of white blood cell. This points more towards an immediate, aggressive, acute infection.
So the microscope helps build a timeline.
Exactly. These microscopic details essentially allow us to sort of read the disease's timeline on that particular farm. And of course, we can do bacterial culture from the lesion itself to confirm the specific agent, which helps guide future prevention strategies. Molecular methods like PCR can also be used if culture is difficult for some reason.
And you need to rule out other things too, presumably.
Absolutely. It's crucial to distinguish endocarditis from other causes of sudden death and heart lesions, especially something called mulberry heart disease.
Mulberry heart.
Yeah, it's related to vitamin E or selenium deficiency. It causes hemorrhages on the heart muscle and necrosis, but importantly, it does not produce those distinct vegetative lesions on the valves. That's a key difference.
Got it. So given how devastating this disease can be, and how it points to bigger problems. What are the most effective strategies to prevent it on a farm? It sounds like it all circles back to that one core principle you mentioned earlier.
You're exactly right. Since endocarditis is ultimately a consequence of systemic infection, of bacteremia, the cornerstone of prevention is stopping bacteria from entering the bloodstream in the first place. Simple concept, but requires a comprehensive, multi-pronged approach in practice.
So what does that look like on the ground?
Well, first, let's talk about management practices and environmental control.
Okay.
Procedural hygiene is huge. Strict hygiene during routine piglet processing things like teeth clipping, tail docking, castration is absolutely vital to prevent wound infections that can serve as entry points.
Makes sense.
Then, control of vices. Addressing things like tail biting, which creates open wounds and is a critical risk factor, is essential. This isn't easy. It means providing environmental enrichment, like straw or chains for them to play with.
Keep them busy.
Yeah. Avoiding overcrowding, ensuring they have enough feeder and water space, maintaining good air quality. It's about reducing the stress that leads to those behaviors.
Right, the stress factor again.
Environmental stress reduction in general. Minimizing stressors like poor ventilation, big temperature swings, inadequate housing, all that plays a significant role in susceptibility.
And pig flow, how pigs move through the farm.
Crucial. Implementing strict all-in, all-out, or AIAO, pig flow. That means batches of pigs are moved through facilities together, and then the facility is thoroughly cleaned and disinfected before the next batch comes in.
Breaking the cycle.
Exactly. It's a powerful tool to break pathogen transmission cycles between groups of pigs.
Okay, so that's general management.
Yeah.
What about targeting this specific bacteria? You mentioned vaccines for one of them.
Yes. Next, we have targeted pathogen control. And for Erysipelothrix Rhusiopathiae, the good news here is that control is highly achievable with vaccination.
Ah, good news.
Yeah. Both injectable and live attenuated vaccines are generally effective. Routine vaccination of the breeding stock, the sows and gilts, is crucial. And in high-pressure environments, maybe vaccinating the growing pigs is also necessary. When we see an outbreak of erysipelas-related endocarditis, it often points directly to a failure in the vaccination program. Either it wasn't done, or maybe the vaccine wasn't stored or administered correctly.
Okay, so erysipelas is manageable with vaccines, but I think you hinted that for Streptococcus suis, the picture is much more complex, isn't it? The vaccine situation isn't as straightforward.
It truly isn't. That's the challenge. There is currently no universally effective vaccine for Streptococcus suis.
Why not?
While commercial vaccines typically target only a few specific serotypes, remember we mentioned serotype 2, but there are many, many different serotypes out there, and these vaccines offer limited cross-protection against the strains they don't include.
So they might not cover the specific type causing problems on a particular farm.
Exactly. Autogenous vaccines, which are custom-made using bacteria isolated from that specific herd, can be used, but honestly, their success varies significantly. It's not a guaranteed solution. And while vaccinating the sows can provide some passive immunity to their piglets through the colostrum, the first milk, this immunity wears off around weaning time, which is precisely when the piglets are most stressed and most susceptible to S. suis infections.
So it runs out just when they need it most.
Pretty much. This whole situation creates what some call the vaccine paradox. While erysipelas is largely vaccine preventable, indicating a program failure if it pops up, with strep suis, where vaccines are much less reliable, the control efforts must focus disproportionately on those non-vaccine strategies we talked about.
Like the management and stress reduction.
Exactly. Optimizing nursery management, rigorously reducing piglet stress during that critical post-weaning period, improving sow health to minimize transmission to their offspring in the first place, and just maintaining really strict biosecurity.
Which brings us to biosecurity. That seems fundamental regardless of the specific bacteria.
Absolutely fundamental across the board. This involves the basics, like sourcing healthy animals from reputable suppliers who have good health programs themselves, implementing strict quarantine protocols for any new animals coming onto the farm.
Keeping diseases out?
Right. And ensuring proper disposal of any dead animals so they don't become ongoing reservoirs for disease on the farm. It's all connected.
Okay, so prevention is complex but critical. But what if a pig does develop signs suggestive of endocarditis? What are the options for treatment then? Is it a condition that can actually be managed effectively once it starts?
Well, treatment really aims to tackle the underlying systemic infection, the bacteremia, and it's most effective if it happens early.
Early intervention.
Yes, there's a critical, pretty narrow therapeutic window here. Antibiotics can be effective before significant valvular lesions, those vegetations, form. However, once a large fibrin-encased vegetation has developed on the valve, its structure, that biofilm-like matrix, maybe even some mineralization starting,
Yeah.
it largely prevents antibiotics from penetrating effectively to kill the bacteria hiding inside.
So the timing is everything.
It really is. Common antibiotics like penicillin, which is usually effective for both erysipelas and Streptococcus ampicillin and Sectifer, are typically used. But for Streptococcus especially, doing susceptibility testing is highly recommended.
To check for resistance.
Exactly. To make sure the chosen antibiotic will actually work against the specific strain involved, because resistance can be an issue. And supportive care is also important. Things like anti-inflammatory drugs to reduce fever and pain, maybe moving sick pigs to clean, warm, less competitive hospital pens to help them recover.
So what's the overall outlook, the prognosis?
It's entirely dependent on the stage of the disease. For pigs with that acute systemic disease fever, lameness, maybe skin lesions that are identified and treated promptly with the right antibiotics, the prognosis for survival is generally pretty good.
Okay, so early treatment can work.
It can. However, once clinical signs of chronic endocarditis and heart failure appear, things like that wasting, severe difficulty breathing, the cyanosis,
Yeah, signs of decline.
the prognosis is unfortunately grave. In a production setting, attempting treatment at this chronic stage is typically considered unrewarding and just not cost-effective.
Too little, too late.
Essentially, yes. These animals usually end up succumbing to congestive heart failure or maybe sudden death, or if they make it to slaughter, their carcasses are likely to be condemned.
So, wrapping this up, what does this all mean for us, the listeners, people who might not be directly involved in pig farming day to day? This deep dive into porcine valvular endocarditis really reveals it as far more than just, a pig disease. It feels like a complex, multi-layered problem. You called it a barometer, a report card for overall herd health, biosecurity, and even, surprisingly, public health.
Yeah, I think if we connect this to the bigger picture, the diagnosis of valvular endocarditis on a farm should truly be seen as a sentinel event.
A sentinel event,
Yeah.
like a warning signal.
Exactly. A bright red flag indicating a significant breakdown somewhere in that farm's herd health program. And as we discussed, even the subtle microscopic differences observed in the lesions themselves can provide valuable clues about the specific underlying disease challenges present. It really just underscores that proactive prevention of bacteremia, stopping those initial infections from ever taking hold, is the only truly effective long-term strategy.
This deep dive really powerfully highlights how interconnected animal health, agricultural practices, and ultimately human well-being truly are, especially given the significant zoonotic implications of common swine pathogens like Streptococcus suis that we talked about.
Right.
This raises, I think, an important question for you listening. How much do you think the health of the animals in our food systems really impacts the health of the broader human community? And maybe, what responsibility do we all have to support best practices on farms that prevent these kinds of systemic issues like PVE from even starting in the first place? Something to think about.